This was the recent legislation passed by the White House, the American Rescue Plan, the $1.9 trillion relief package, allots about almost $58 billion on just testing, contact tracing, and mitigation efforts for COVID-19. So clearly, contact tracing is a considerable component of our fight out of this kind of last leg or so of the pandemic. And I'll quickly explain the contact tracing process, its objectives, and how things are kind of currently tracked manually and can be improved. So the objective for contact tracing is basically to work with an infected individual to identify and provide support to not only them, but also potentially their infected contacts. So the reason we do this is to prevent or to mitigate the community spread of COVID-19 in our community. And the process first starts off with a confirmed case of COVID-19. The local Department of Health is notified, and then they immediately act to interview the infected individual. The health department will console the individual into isolation and will begin to notify any close contacts that the infected individual has had. And the CDC, for the purposes of our presentation, their definition of a close contact is someone who was within 6 feet of an infected person for at least 15 minutes. And lastly, over the next 14 days or so, these contact tracers will follow up with the infected individual as well as their contacts via phone and email. So in this example and in this process, there are kind of three main stakeholders that we'll be following with today. So first is the clinic. This is the place where you go to, or the person receiving the test will go to get the nasal swab, the PCR test, the whole jazz that I'm sure we are all kind of familiar with now. The second here is the laboratories that actually take in these results and process these results. And lastly, the local health department. They're the folks providing the contact tracing. They are the folks that are updating, the local dashboards and taking data analysis on the spread of COVID-19 in the community. So as you can see, this is all a really big, multifaceted system that ultimately relies on speed and efficiency of scarce resources in order to truly be effective as a means to mitigate COVID-19. The Lancet peer-reviewed medical journal actually found that contact tracing strategies are only truly effective if they can be done in less than 3 days. What that means is we have to beat the speed of the reproduction of COVID-19 to other infected contacts and really act fast. But the reality, across the United States, from states like Hawaii to Austin, Texas, and even to New York, we're seeing headlines in the news like these. Bottlenecks, and on top of all of these kind of bottlenecks and inefficiencies, an article co-authored by the University of Oxford found that for every infected individual that we contact trace, there are an average 36 other contacts. So it's incredibly, incredibly difficult to pull this whole contact tracing process off at scale with the current technology, i.e. fax machines that we have today. So this means that traditional communication in healthcare, really the fax machine, is simply too slow to support effective contact tracing efforts. And this takes a public health toll. So now the question really becomes, how can we create and implement these efficient and secure systems that can both not only scale, but also ultimately protect the health as well as the privacy of those in our community? And the common denominator here is that whether we're automating, sending follow-up emails from contact tracers, or reading and storing test result data from electronic health records, or processing test results and sending them to the local health department, Paubox's email API can really be the foundation or a cornerstone that kind of wraps around and supports any modern public health application. So lastly, to really dive into kind of seeing how this will affect each stakeholder in this process, we're really going to try to ultimately save lives through this added efficiency. This all really boils down to leveraging the power of modern technologies, specifically email, and its scalability and efficiency to save lives. So the goal is to maintain a high level of efficacy or effectiveness of contact tracing at scale. So for the clinic, and this is for not only the clinic, but also the patient that we're kind of familiar with, is finding access to your messages without any extra friction or any added steps. No complicated portals you have to log in, fiddle with your phone to try to access a message. And ultimately also a lower learning curve for those working at the clinic that need to send out these emails. For those that work at laboratories, increased efficiency over the old archaic fax machine. We can scale these sending large amounts of messages faster without compromising any speed. We'll be able to integrate seamlessly into existing business logic or test result delivery logic, where simply the email API is simply a little set of methods in your code that can ultimately scale and send messages securely at scale. And for the local health department, we're increasing efficiency of those contact tracing. We're automating what can be automated and supporting the limited number of contact tracers. And as we've talked about this whole time, we're maintaining effectiveness of the contact tracing programs, even at scale, even when there's a lot of COVID-19 going on.